going to start out. When Dr. Baker and I were talking about this, we realized we probably actually should have just done this jointly instead of one of us go first and the other one follow. Because probably half of my slides she could read or tell about you to you in her sleep. So I feel like my role has been in healthcare for quite some time, and since we moved here, I haven't been in private practice. I've kind of been more in the educational realm. So I kind of wanted to start off a little bit about that because my husband's passion has kind of trickled down to me and to this area. And as you just heard, both Katie and I are from East Tennessee. And so for me, coming back to this institution and having an impact on our county, on our community, and the state in which I grew up in means a lot to me. And so I truly feel like I'm in this knowledge economy. That's exactly what we're in. Where it's through technical, educational, and continual learning that it's what's going to drive this economic force and allow this community to grow. And higher education is at the foundation of this. I'm going to go through these pretty quick, but Katie kind of came up with this topic, and it's funny because we both have little diverse backgrounds, but yet then they come together as one. And it's this community and campus that come together that really is crucial in moving our economy forward, and especially in the realm of public health. Where are my public health people? Okay, so you all, like I said, also maybe able to even talk about this even more so than I am. But like I just said, the economy knowledge that we are in right now is based on higher education, and it's not going to change. It's only going to continue to move forward. So we have to invest in human capital, and that's what we do as a university. We invest in human capital, but with the premise that both public and private will benefit from this. It's based on that notion that we will benefit publicly and privately, and that it's only through educational attainment are we going to see this. And that's what will affect the society as a whole. And you can look on my slide right here and show this is a benefit that you will see, a public benefit. The greater the education that you have, the more you're going to be involved in your community. You can see a bachelor's degree or higher goes out to vote more than someone who has less than a high school education. And that's a no-brainer, I think, for most people. The higher level of education that you have, the more you're involved with society. Again, public and private benefits. Unemployment rate. This was from 2011. Right now, as of December, we have the lowest unemployment rate, 5.6 as a nation. And then as a state, we're still not quite there yet. We're like at 6.6, 6.7 somewhere %. But you can see education pays, public and private. You're going to have less unemployment, and also your weekly incomes are going to improve. You can see from a doctoral professional degree the significant difference of a weekly income, and again on a yearly income, the difference between a doctoral professional degree and less than a high school degree. This is one of my husband's favorite quotes that he has, and I love this chart because it goes to prove a point, and it's really an eye-opener point. Out of every 100 ninth graders, 71 will graduate from high school. Out of those 71, 44 will enter college. 29 of those will only be enrolled during their sophomore year. And then 19 out of that 100 that originally started will end up graduating college within 6 years. That's amazing. We've got to invest more. Even though we do as a university, we invest in human capital, we're not seeing those changes that we need to see. And you can see as a nation, we're just at 21, so we fall below that as a nation. Now looking at the country as a whole, green, good, red, pink, bad. And you can see where the state of Tennessee falls. We are not where we should be. Moving on down to state, you can see Washington County. I'm just going to get this pointer to work here. Probably not so good with the pointer here. But this white county right here, Washington County, Knox County, Davidson, Nashville, Shelby County, percent of population with a high school degree. Average for Tennessee, 83.2% with a high school degree. Average for U.S. is 85.3%. We're falling short at the high school level. Washington County, we're at 84.4. So as a whole, as a county, we're doing pretty well. But as a state, we're not doing so great. Williamson County, which probably most of you all would realize is doing very well, at 94.8%, and Lake County, which is in West Tennessee, is very poor with 66.1%. So now we've talked about high school, let's go to a bachelor's degree. Average for Tennessee, so we just moved, if you remember, from 80-some% to now 22. Average for Tennessee, 22.9. Average for US, 28%. Washington County is 27.9. So we're just below the national average, which I think ETSU has a lot to do with that. And again, this community interface that we have with the community, with the university, makes a significant difference. And the numbers don't lie. This is based on 2010 data. 2011, many of you all may know, and we'll talk a little bit about this, whether you like Governor Haslam or not, it's not a political statement, the drive to 55, which bases on the premise that 55% of the population will either have a certificate or a college degree by the year of 2025. You can see, this was from 2014, the data here. We have not changed much. The previous data slide that I had, or the data on the previous slide, from 2010, we haven't changed. 4 years have gone by and we have not really changed our educational attainment level. But I did want to point out one thing on this, and anybody can go to this website. It's Drive to 55 website, and it'll pull up by county. So if you want to look at where you're from, anywhere in the state of Tennessee, you can pull up your own statistics. But I did want to say and call your attention to, it says top colleges selected by recent high school graduates in the county. East Tennessee State was number 1 with 278. So I feel pretty proud that we're a college of choice in that area. You can't talk about educational attainment levels if you don't talk about income. Again, 2010 data, the average income for the state of Tennessee, $42,279. Average for the United States, $50,000. We are still falling short. I mean, I keep saying that, and you will continue to hear this theme of education, educational attainment, and the need for increasing that. But Williamson County, 87,000, and Hancock County, 23,000. I mean, that's a big difference between those two. Washington County, we're still short, even though our educational attainment rate is almost with the U.S. average, just a little bit below. We are still lower on income than we should be. You can see it's not just a Tennessee effect. Poverty levels, you see it everywhere. I would say you could generalize and say it's the South, but it's not. It's not just the East or the West. We have those issues everywhere. Again, green good, red, pink bad. Because it's probably hard to see the scale from where you are. So how do we change that, and where should we focus our concentration levels on? You can see here that growth, or projected growth, is really going to be in the realm of healthcare. Whether it's public health or whether it's technology, advanced degrees, you're going to see an increase in that. We're not seeing increase in those skill-related jobs. We're just not. You'll see, like I said, healthcare, baby boomers getting older, and the healthcare needs are going to be lower. Of the 5 million projected new jobs, 25% are expected to be in construction, retail, and the offices of health practitioners, which is just like what I said, healthcare also. And 7 of the 20 industries gaining the most jobs are in healthcare and social assistance sectors. Of the 30 occupations with the fastest job growth, 17 of those are going to require post-secondary education degrees. So we've got to restructure the way that we think. So what determines or what impacts our health? This is on my public health slides. Genetics we can't change, but everything else we can have an impact on. And it's just this constant continuation, ongoing, that are going to affect people. And we cannot concentrate on one thing and ignore everything else, which is, I think, you'll probably hear also Katie say this. 2014 health rankings, which College of Public Health probably, they love to publicize this as well, but we are 45 out of 50 states. We moved from 42 down. South Carolina took our position. But West Virginia, I came from West Virginia. West Virginia is above the state of Tennessee as far as when it comes to public health rankings. So when you look at where we stand, individual factors, violent crime, we're 50 out of 50. Physical inactivity, 49. Obesity, 47. Smoking, 46. Preventable hospitalizations, 46. And then I think the next one really concentrated on maternal and children's health. Children in poverty, 45th. Low birth weight, 44th. Infant mortality, 41st. Drug deaths, 40th. Premature birth rate, 40th. Chlamydia, 39. Immunization of teenagers, 36. And immunizations of children, 33rd. I can't tell you in my private practice that I've had, I have talked until I've been blue in the face about immunizations for teenagers, especially HPV. Many of you all, I'm sure, are aware of that, and we'll talk about that in a minute. I can't get mothers to change their mind. And part of that is because they feel that they're giving their children an okay to have sexual intercourse at an early age if they were to get immunized against HPV. It's educating the parents and then letting that trickle down to the children, and then also educating the children so that they can actually go to their parents and have a conversation with them. Collaboration between Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute looked at two things: health outcomes and health factors. Health outcomes being the length of life as well as quality of life. Health factors, looking at health behaviors, clinical care, social and economic factors, and the physical environment. So where do we stand? 2014 for looking at health outcomes. Again, length of life and quality of life. Those were the two measures that were looked at. Washington County, we're up here. We ranked 19th. Not so bad. There are 95 counties, for those of you who do not know, in the state of Tennessee, and we ranked 19th. Williamson County, again, ranked first, and Grundy County, 95th. Now we look at health factors and where we stand. That was the combination, if you remember on that chart: health behaviors, clinical care, socioeconomic factors, and environmental influence. Where do we stand in Washington County? We were ranked 5th. Again, Williamson County. I'm here in Williamson County. I should move to Williamson County. But I love the mountains here too much. But Hancock County ranked 95th. So it kind of led me to think, well, what do we do here from a health standpoint? What do we see, and who do we see at our health clinic here on campus? If you can see, these are for fall 2014 at our student health clinic. Regardless of whether you are full-time or part-time, we're seeing more females in our health clinic than we are males. Whether they're undergraduate or whether they're graduate students, there's still more females. So I applaud the women for seeking health care. The men aren't too far behind, but again, it's nice to see that women are being proactive about their health care. So what are the top diagnoses that we are seeing in our health clinic? The first one was acute pharyngitis, swollen throats, anxiety, acute upper respiratory infection, dysuria, painful urination, depression, high-risk sexual behavior, which I was actually really surprised about this because I felt like we would probably see high-risk sexual behavior in the top 5. And we didn't. So either they're not getting seen, especially with chlamydia being ranked 39th, either they're not getting seen or they're not being seen by our health clinic, or it's not as big of an issue as what I thought it would be, which could be. But it was kind of a nice breakdown of a little bit of everything that they see here on campus. I could probably ask you what the leading cause of death is in women, and everybody probably can raise their hand and say that it's health disease or heart disease, with cancer following short of that second, and then stroke. Only thing I think probably most people wouldn't expect would be septicemia, which is an infection in the blood. So then, again, on the topic of education, how education impacts our health, if you look at life expectancy for someone who is age 25, there is a 5-year difference in females from less than a high school education to college degree of their life expectancy. They can live, on average, 5.1 years longer than someone who only has a high school degree. Men, for those of you in the room, you get 6.8 years longer, so you get more bang for your buck, I guess, than the ladies do. Top leading cause of death of Tennessee women. Shout out something. What do you think? What do you think is the top number one cause of death in women?
Accidents.
Accidents.
Heart disease. Heart attack.
Heart disease.
Murder.
Poisoning. Poisoning. Then heart. Breast cancer. Traffic accidents. Diabetes. Suicide. Liver disease. Stroke. HIV and AIDS. Lung cancer.
Explain poisoning.
I'm not really sure. Actually, when you look through the statistics, it's what popped up.
I believe drug overdoses maybe.
And I was going to say, that's another thing, because we're seeing a shift in that, and we'll see, and then we've got a lot of people who've been working on prescription drug use and combating that. So that would be Tennessee life expectancy for female, 79.1. U.S. life expectancy is 84.8. And I remember that's changed too, because when I was in school, I remember it being 82. Average life expectancy for a female when I was in college was 82. So we are expanding that, which a lot has to do with technology and better pharmaceuticals, access to more research. You know, a lot's happened in several years. So we talk about in the topic, we talked about really kind of concentrating on women's health, and women's health being my area. Everybody dreads the annual exam. You go there, you think, okay, breast exam and pap smear. Those are the things that we really want to go, and that's what we're focused on. So I'm just going to talk about those two things just briefly. But 1 in 8 women will be diagnosed with breast cancer, and probably you all could roll that off your tongue anyway. It's so much in the media now that we didn't used to see that in the media. We didn't used to see that on commercials. But everybody knows the pink ribbon. So awareness, I think, has been a great friend of ours as well. Most common cancer in women worldwide. The good thing is we are seeing a reduction in breast cancer incidence. And that's in women 50 and older. And I think that a lot of that's because of education, and also, which can be a heated discussion, but many of you may have heard of the Women's Health Initiative study that came out, which talked about the effects of estrogen and progesterone on breast tissue. And did it relate to breast cancer? Did it increase your risk or not? I mean, numerous trials have occurred after that original study, which was produced like in 2000. I remember going to a conference, and that first day I had read, it came out the night before, and everybody's slides at this conference were now obsolete because it had just proven wrong what everybody was talking about. And I was so excited because this very controversial article came out, and I thought, I cannot wait to hear what they're going to say. Well, they didn't mention it one time. They just kept presenting and presenting because, you know, it came out literally the day before, so a lot of the presenters had flown from other states. But we're also seeing, since 1990, the death rate for breast cancer has been declining, and a lot of that has to do with technology, a lot of it has to do with awareness, a lot of it has to do with the Women's Health Study as well. But we're still not doing everything perfectly right, because only 67% of women 40 years of age or older have had a mammogram in the past 2 years. If you'll recall, you're supposed to have mammograms yearly starting at age 40. whether you like it or not. I've had multiple patients before in practice who have argued with me about going to have their mammogram, that it's so uncomfortable, they don't like it. Well, 1 in 8, you just have to throw the statistics out. 1 in 8 will be diagnosed with breast cancer. Do you want to be one of those, 1 in 8, or do you want to be proactive and take control of your health? 3 most common cancers in women: breast cancer, lung cancer, and colorectal. But deaths associated with cancer, actually lung cancer is first, breast cancer, then colorectal cancer. Cervical cancer, for all of you, this is a cervix, if you do not know. But cervical cancer, actually, we're doing pretty well when it comes to that, and as far as treatment. We did have an increase in those cases that were diagnosed between 1980 and 2010, but that's also because of screening techniques. We're doing really well on screening. Yeah. Okay. She's my timekeeper telling me to keep. I thought she was going to chime in with something really important there.
You were trying to
by age 50, 80% of all women will have acquired HPV, which makes also for very interesting conversations with women who are now back out in the dating market. They have been, their husband's deceased, they are divorced, and they're now starting to go and date, and you're in a room for a long time discussing these topics with patients, which is a good thing. But a lot's changed since they were out on the dating scene. So, cervical cancer is a sexually transmitted disease. 99% of all cases of cervical cancer are related to what's called HPV, human papillomavirus. It's easier for a woman to get it from a man than it is for a man to get it to a woman. Again, you got the heads up. It's okay. But more than 75% of sexually active women have been exposed to HPV. But in most cases, and this is what people don't realize, in most cases, HPV goes away on its own. If you're healthy, HPV will go away on its own. And before, when I first started practice, we were over-treating these. We were treating the 21, the 18-year-old that came in with HPV, and we've learned over time and through statistics that they're going to clear it on their own, and they'll probably go back to normal. So that's why Pap smears do not start until you're 21 years of age. You can see here, these are only HPV-associated cancer rates, but you can see here in the cervix and in the vagina, as far as cancer is concerned, they occur, again, education, poverty, in counties where the poverty level is 20% or higher. And that's because they're not having access to health care. They don't have insurance, they're uninsured, and so the other cancers that you see in a poverty level less than 10, vulvar or anal, head, and neck are probably related to the fact that those are actually ones that they're going in to see their primary care provider and they're getting picked up. These are ones that are not getting picked up because 50% of all cervical cancers occur in patients who have never had a Pap smear, or that's their first Pap smear. So, we are seeing a huge epidemic of prescription drug abuse. And College of Public Health can speak to this. Katie can probably even speak to this a ton. But we are seeing a large amount of this, and we're really trying to work hard. Our College of Public Health is working on it. Our College of Pharmacy is working on that as well. But I found this to be very interesting that 12th graders, this is their past use of illicit drugs and pharmaceuticals. 36.4% of all 12th graders have used marijuana. 11.3% have used synthetic marijuana. And then you go on down the list where, cocaine, 2.7% of 12th graders have used this. This is our future. This is who we're trying to fill that crack, 100%, which this is who we're trying to fill it with. And if we don't combat this at an early age, it's going to be very, very difficult for us as an economy and for us as a community to progress forward and change any of those numbers when it comes to the state of Tennessee or Washington County. Tennessee's Controlled Substance Monitoring Database 2010. This was a result of the Controlled Database Act, which started in 2002, which has been a godsend for anybody who practices medicine, because you can look on there, you can go onto the pharmacy registry, and you can look up and see what prescriptions people have been prescribed and who's been the provider. But if you look at this, 51 hydrocodone pills prescribed per Tennessean at the age of 12 and up. That's how many pills we have in this area. That database has been wonderful. And I can't tell you the number of times I've actually used this to tell patients that I cannot prescribe their medications when I was in practice. 2 in 5 teens agree that prescription medicines, even if they're not prescribed by a doctor, are much safer than illicit drug use. Nearly 1/3 of teens believe there's nothing wrong with using prescription medications without a prescription, just maybe even once in a while. Nearly 3 out of 10 teens believe prescription pain relievers not prescribed by a doctor are not addictive. And more than half of teens think using cough medicines to get high is not risky. That's crazy. So what do? This is an ongoing cycle. We have to improve access to healthcare. We have to help in terms of healthcare initiatives, educate, create jobs, and modify behaviors. This is just a vicious ongoing cycle. Real quick, Drive to 55, as far as from an education standpoint, created a board to help with combating educational levels in the state. Again, whether you like having them or not, this is the initiative that put before us and the challenge, but I wanted to call attention to, this is the board that serves it, and 1/3 of this board actually are involved with healthcare services. So again, impacting our community, affecting health outcomes. And then also Mark Costa from Eastman is on this advisory board. Tennessee Promise, many of you may know, came out this year. We'll start this fall 2015. 2-year college tuition free. It's the last resort scholarship where they've got to get Pell, they've got to get Hope, and the TSAA. They've got to go through all those things first, but then they can get 2 years of applied technology or community college for free. Tennessee Reconnect, any adults that have some sort of college education but haven't completed the degree, they can go back and get their certificate or their degree for free. LEAP is a program that's still in the works, but also trying to create skills that your community needs or that industry in your area are in desperate need of. And so it's trying to, through education, create and educate a society that can then fill those needs or those skill sets. So what can we do? In essence, this whole slide says we've got to work together. We've got to work together as a community. We've got to get involved with our community, as which Dr. Baker is going to follow up on, so that we can combat some of these issues. Not just education, but education is the root of all of this, and really what's going to change this. So I'm going to turn it over to Dr. Baker now.
So it's interesting. I came up with this topic because this is my life. This is what I live and breathe every day, the community campus interface, and it means a lot to me. As a Niswonger scholar, we are tasked with returning to the 1st Congressional District of East Tennessee to live here and work here and serve here in exchange for a free education, which is a pretty good deal, if you ask me. But I'm fascinated at this age and stage of my life to reflect on the values that foundation instilled in me, that it wasn't returning home to earn a paycheck. It wasn't returning home for any specific job or position. It was returning home to improve the lives of the people in the communities that supported us to get here. So the first full day I spent with Donna, I didn't know that she was from Greenville, and I was planning my 10-year high school reunion, and I said that to her, that I was very stressed out about this 10-year high school reunion. And she explained that she was in the midst of planning her 20-year high school reunion from the same high school. And we have enjoyed spending time together at events and community-based efforts ever since then. So I tell my own personal story a lot, so I'm going to tell some other people's stories today. So we'll begin the conversation with what does the ETSU community interface look like? You're going to recognize a lot of these faces. I'm going to give you my personal definition of a campus community partnership and the campus community interface because, again, I eat, sleep, breathe this every day. And I want you all to walk away not only with a sense of ownership, but a sense of mission and some motivation to go do some of this yourself, because it's the most rewarding work you could ever ask for. And I'll give you one of my favorite examples of campus community partnerships that I really am not even involved in. I'm going to tell other women's stories today. Sorry, men, I'm going to tell women's stories today. It's the Women on Wednesdays. I'm going to give you some expert tips on how to go and start community partnerships on your own if you're interested, or with your department or with your student organization. I anticipated a lot of undergraduate students today, therefore I wore very hip shoes. But I like that we have a more diverse crowd. I don't like that my feet hurt very bad. And then again, I'll wrap up with some more examples. So I stole Donna's slide, right? I had the advantage of seeing Donna's slide early on in the game. So I stole one because I love this slide. And it really illustrates why we're all here today, because we're all in this together. We all have a responsibility to address women's health issues. And so community members are at the center of this circle, because if we forget that we have to engage key groups and we have to engage our community members in identifying and addressing their needs, then we've missed the ball. We won't ever achieve our goals if we don't keep that at the heart of what we do. And you may not be able to see the words in all these different bubbles, but I guarantee that you fit in one or more of those bubbles, and that you can own your very small piece of this effort. So with that, some of you are about to see your pictures on the screen. So I apologize if it's not the most flattering picture, or not the one you would have chosen, or if it's blurry because I stole it from Google. So when you ask, what does the campus community interface look like at ETSU? Well, it looks like this. It looks like the women that you pass in the hallways every single day. So who in this room is on the slide? Phillips. Phyllis is on there.
Yeah.
Who knows someone on this slide? Okay, so I just got done with a 2.5-hour lecture, and so I'm wanting you guys to talk. So who recognizes someone and wants to tell me how they might serve as a campus community interfacer? Jana?
I know Kim Bushra-Mackey.
Hey, here's Kim.
Who's a graduate of ETSU and of our counseling program, and also is the director of Shakti in the Mountains, and does an amazing amount of programming. Pat Robertson, I know, is a former chair of Human Development and Learning, and also has had a significant impact on the university, and I think also in the community around diversity and affirmation. And I could go on, but I'll let somebody else.
Great. Who else knows someone up here? Carter?
Carol Transu,
Okay.
up in the top middle. She is a member of my mother's book club, which does continuing education. They have really educationally diverse discussions with small group of women, and very politically active, and she's also a member of the Women's Fund.
Yes, I will go into her work at the Women's Fund in my presentation, so don't say too much about Carol. Megan?
Jenny Kidwell, she's in the blue in the middle. She's the director of the Tennessee Institute of Public Health. And she's a phenomenal leader and very instrumental in bringing business, education, and health together to meet at the table and have conversations that most of the time you see them working in silos on.
Side note, Jenny was an alderwoman in Greenville for 4 terms, actually, so she's another Greenville girl. Brittany?
Stacey Williams on the bottom left. She's the IRB chair, just got tenure a couple years ago in the psychology department, works with stigma and LGBT, and is just phenomenal.
Great. So, yes.
Officer Amanda Worley is, she's an officer on our police force here, public safety at ETSU. She also teaches courses every semester on rape, aggression, defense. Works with young women on how to prevent, to educate and prevent sexual violence. And she also is there if someone has been attacked to make sure that that young woman gets the same nurse when she goes to Johnson City Medical Center. So she's in the community in multiple ways, both at ETSU and Johnson City.
So these are the women who are serving at the interface of ETSU in our community. And I applaud them, I respect them, I love a lot of them. A lot of them have been very instrumental in me being here today, and I'm grateful for that. So on to my personal definition. My definition of campus community interface is a scenario in which students, staff, faculty, and or administrators of a university like ours leverage their resources and expertise to engage community members in addressing self-identified needs with the ultimate goal of establishing a reciprocal collaborative relationship. That's a mouthful, but let me highlight some important points. So first of all, anyone at a university can get involved in this effort. You don't have to have a prestigious title. You don't have to have a charge from a class or a charge from a department chair that you need to go out and do service. Rather, anyone can get involved at any time. Leveraging their resources and expertise. I think oftentimes, especially students, sit back and think, well, I'm not an expert in this. I can't go out and do anything about this. You saw Donna's slides. 19 out of every 100 people in the state of Tennessee will have a bachelor's degree. Therefore, you are an expert. By virtue of being in the seat you're in today, you are an expert. And it's easy to sit in our departments and in our silos and say we don't have the resources to go out and do that sort of project or initiative. Again, it's all relative. And if you can work on the synergy in your department, within your organization, I guarantee you can scrounge up some resources to get something done. So don't ever think that you don't have the resources or expertise. Just start the conversation. You're more knowledgeable than you give yourself credit for. Engaging community members to address self-identified needs. I hinted at this already, but if you go into a community, for example, and you say, prescription drug abuse is your problem, and we need to deal with this problem. But they're more concerned about putting food on the table at night. They may not hear your message about prescription drug abuse. They may still be concerned about food on the table. So if you first need to address food on the table, address food on the table. Let them tell you what they need. And then make sure that you're benefiting from it. And I know that sounds selfish, but we all have to get up and go every day. And we need to make sure that relationships are mutually beneficial, and that a lot of people may get satisfaction from seeing people's lives improve, but don't discount using opportunities to your advantage in the classroom or in work. Especially at ETSU, we are a service-oriented university where many of your community-based initiatives will be rewarded and acknowledged and incentivized in the classroom and in your department. So don't shy away from benefiting. Don't shy away from documenting. Don't shy away from publishing what you've done. Don't shy away from singing your own praises. That's hard for a lot of people to do, especially a lot of women to do. But you have every right to be proud of what you're doing and to tell people about it. You never know who will want to join in your effort. So Carol Transu is the founder of the Women's Fund. Carter said she recognized Carol. Carol is one of my very closest friends, and I really respect the work she's done at the Women's Fund. She pulled together, for lack of a better word, some very wealthy women that she knew and asked them to donate very large chunks of money to begin an organization that would focus on addressing barriers to self-sufficiency among low-income women and girls in 25 counties in East Tennessee. Then she engaged in a campus community partnership. She contracted with faculty here at ETSU, Dr. Jamie Kreidler in the Department of Human Development, and also Linda Daughtery from the University of Tennessee. So she pulled those resources and expertise from a university setting and had these women engage in a research study to figure out what are the barriers women face in our community. And in their report, they quote that much of East Tennessee is plagued by high rates of unemployment and poverty. Women in this area face many barriers in their quest for self-sufficiency. So they went all around East Tennessee, the 25 counties, and they listened to and they learned from our women. They did 59 interviews and 4 focus groups with women and providers in the area from these 25 counties. Raise your hand if you are from one of these 25 counties. Okay. So these statistics are actually, they're qualitative statements, they're not statistics. This qualitative data should ring true to some of you, if not all of you, from living in this region for a while. And here are a group of Women's Fund members, again, who are contributing their financial resources. They are doing their part to contribute to the process. So the very number one need identified by women in our area was they needed education and work-related skills. Does that not echo what Donna just showed us statistically? They are craving education and work-related skills. They want a high school diploma. They want to develop their technical skills. They need to know how to search for a job and how to fill out an application online. They need to know they need soft skills, how to be punctual, how to interact socially in the workplace. They need childcare and transportation. They need help planning their course. They don't need a 3 to 5 year plan. I'm worried about food on the table and who's going to get the kid to school tomorrow. And to drive this point home again, they need help preventing substance abuse in their family and treating it in their family as well. So one of the recipients of one of the Women's Fund's grants in 2014 was Red Legacy Recovery, and I cannot sing their praises enough. This is Angeline Murray, the founder of Red Legacy Recovery. They provide all these services to women who are transitioning out of the jail systems here locally. They're located in Elizabeth, where their office is. But here's Carol again. I love Carol. This is Terry Morgan, the executive director of the Women's Fund. This young woman is a student here at ETSU, I believe getting her bachelor's degree in social work, maybe her master's degree in social work. So here's a campus community partnership, right? How else can we get involved in the community? You can do your field experience there if you need to, right? That's a perfect way to develop a mutually beneficial relationship. She's now employed by Red Legacy and will continue working with them after graduating. So that's a $15,000 grant to buy van, is what they received from the Women's Fund. These women also report that they need help with some life skills, financial literacy. How do you make a budget? How do you pay your bills on time? How do you plan for that? How do you navigate systems to improve your food security and your housing security? In my class this morning, I teach a health communications class, and I asked the students to bring in examples of health communication that they've seen. And one student brought in these 2 opposing billboards, and one was about childhood obesity and one was about McDonald's, right? And they're right there together. It was this fascinating picture. But both, along the bottom of both billboards, the one about childhood obesity had an ad for food stamps. It's easy to get food stamps. Call this number. The bottom of the McDonald's board, eat the dollar. So both billboards are appealing to people with very low incomes, right? But I bet it's a lot easier to drive through the drive-thru and get the dollar menu items than it is to call the number, go to the office, figure out how to get food stamps, then go get them, then go to the store. So they need help navigating those systems. They need to know about parenting, appropriate ways to parent. They need to practice their social skills and understand appropriate models of social interaction. Many people are growing up in impoverished homes. They may not have had parents at home every night. Mom and dad may have been working. And again, they need help planning. This is the New Opportunity School for Women, a perfect example of a campus and community partnership. These schools are located at Bluefield College, Maryville College, Lees-McRae, and Berea. The first one was started at Berea. So this is actually a residential program where women come in for 3 weeks and they stay on campus and they learn these life skills. They learn some of those basic work skills. So this was actually a grant for $80,000 to get the Maryville New Opportunity School off the ground and enroll 14 women between the ages of 30 and 50. The study that the faculty members did revealed 3 other areas of interest. Though the Women's Fund is not funding in these areas yet, they may later. Domestic violence being one of those. Tennessee is ranked 50 out of 50 in violence. Domestic violence being a huge part of that. Physical or mental illness, including drug and alcohol abuse and addiction, of course, is a concern because women are not only impacted by their own abuse, but they're impacted by the abuse that their children may engage in and that other family members engage in. And transportation came up as one of the top 5 needs in this study. So again, these are the areas we have to focus on. And I tell you all that because these are women in our backyards, and very rarely do people study the women in our backyards. This part of the world is often overlooked when it comes to these qualitative needs-based pieces. So I tell you this because I believe these are areas where you can go out and act, where you can form your campus community partnership. So this is a very official definition of partnerships, unlike my very unofficial definition earlier. Essentially, partnerships are the process of 2 or more people envisioning a better life for themselves and the community in which they live, learning together to accomplish a better life, and then working together and creating it. So again, I'm trying to frame the context and encourage you to partner with someone or some organization to get this done. In definitions of partnerships across the board, they emphasize relationships. So much of what we do is relational. And if I've learned anything in 5 months of public service, it's relationships, relationships, relationships. You have to be kind to people, you have to be approachable, you have to be authentic and honest and trustworthy. All definitions have this idea of shared purpose that serves the common good. Again, a reconnection to the idea that we're all in this together, despite differing opinions and views. The whole is greater than the sum of its parts. There are various kinds of campus community partnerships. ETSU as an institution can engage in a community partnership, and I'll show you an example of that in a little while. Colleges, departments can engage in a community partnership. Individual faculty members can engage in a partnership for service learning opportunities or for community-based research opportunities. Again, I want you to see how these partnerships can be mutually beneficial. Students on their own or in a small group can become engaged in community partnerships, or student organizations can engage in community partnerships. So there's no one-size-fits-all approach. When you pursue a partnership, there are processes you have to go through. Each partner should identify what they have to offer. You have to continue dialogue and establish a common language, understand the culture from which each other comes, always be negotiating, always be problem solving, work together to set your agendas, and make sure you have the supporting infrastructure in place. Your outcomes should be meaningful to both parties, and of course, you're looking for ultimate change in both parties at the end of the day. You want there to be some sort of significant transformation. I want to make sure that we have time for questions, and I want to go through some more examples of ETSU partnerships. So I have put these slides here on this computer that is not mine, so I imagine somebody will have access to them if you want to look at these. Okay. So as I show these examples, I would encourage you to shout out the kind of partnership you think it is, right? Here are some kinds of partnerships that we talk about. All right, so this is Lisa Tipton, the founder and director of Families Free, which is a faith-based organization here in Johnson City that helps women who have just given birth to a baby diagnosed with neonatal abstinence syndrome. And you haven't been in Johnson City in the last year and not heard the phrase neonatal abstinence syndrome. They have the highest rate of neonatal abstinence syndrome in the country. And that is babies born in withdrawal from opiates. So they have a grant from the Tennessee Department of Health, a partnership, to do a pilot program with 25 women who have just given birth to NAS babies to take them through outpatient treatment. Cindy Phillips is a doctoral student in the College of Public Health who has not only provided evaluation services to Families Free as a part of her field experience, but who works there as a research assistant, I'm her supervisor, to collect data on barriers to contraceptive care as a means of primary prevention of neonatal abstinence syndrome in the future. So what kind of partnership is this?
Student community.
Student community, or even faculty-student community. We maybe need to add another category because it requires a supervisor. All right. Oh, I did put men on the is that? So you may know these men. This is Rob Pagnick Hagemeyer and Dr. Gray. Dr. Gray and Dr. Hagemeyer from College of Pharmacy and Dr. Pag from Public Health. And these are students who participated in the drug take-back program. So this team also does monthly working group meetings where they rotate around the community and they invite any community member to come in. It was put in the paper when they first started their group that anyone was welcome to join them, and anyone has. They sometimes have huge groups of 50 to 60 people, and sometimes it's their small research teams. This is a federally funded research project that is now bringing in the community. So what sort of partnership is this?
Faculty student community research.
There you go. So that, they have graduate assistants, you're right, so they're students. So these are faculty community research partnerships. Exactly. And then the Johnson City Community Health Center, which is kind of run jointly through the College of Nursing and the College of Clinical and Rehabilitative Health Sciences. However, we have students from all the health disciplines and social work and psychology from across campus working out of this space. So what kind of partnership is that? It's like an institution community partnership, right? And there are several satellite clinics as well. So to bring it all home, Donna did such a fantastic job of presenting you with the data to show you where we stand as a state. I wanted to hone in on where we stand as a region. So where are we in East Tennessee? What do women here need? What are some examples of what's already going on, and then how you can get involved and approach this opportunity. So you can approach any one of these women on the slide. You can approach me, you can approach Donna with advice on how to get involved. I'd love to see any of your names on the ballot in 2018 because I'm the only woman on the county commission. I don't know if y'all knew that, but I'd love to have any of y'all join me. There are 25 of us. But I want to leave you on a motivational note and to tell you that no matter what contribution you have to make, large or small, we can address the scary statistics that Donna presented. If we do it together, if we do it in partnership, and if we do it remembering that we're all in it together. So thank y'all for your time.
Let me open the floor for questions.
Okay.
We're done.
Yes, please.
So we hear different things now about women's examinations, that they're not necessary annually. What are your thoughts about that?
I would still encourage you to go annually, but it doesn't necessarily mean that, at one time there was information that women shouldn't do self-breast exams. Well, I mean, it's not harmful, it doesn't, it's safe, and I think it's just women getting to know their body. But as far as pap smears go, you don't necessarily have to have one every year. Beyond the age of 30 to even 65, if you've had 3 negative pap smears in a row, or if you have had a negative HPV, then they're saying you don't necessarily have to. You can have a pap every year, but we're doing co-testing now, and we didn't used to have that, which co-testing is pap smears with HPV testing as well. Because if the pap comes negative, you still have the chance of HPV. So once you co-test, you can push out that screening a little bit longer. There was also some push probably about 5 years ago about not getting mammograms until you were 50. Well, that hit the roof, everybody, because even though the yield may be very low, if that's you, that's your mom, that's your grandmother, it makes a big difference. And we know that early detection, your survival rate is better. So, it kind of stands to reason that leaving it at 40 is probably the best recommendation. So,
Yes, this isn't so much a question, it's just a request for the information on the organizations that you had in your on your slides.
Yeah, I'll compile easier, a more accessible list with links and everything.
And in addition to what Katie said, within the past couple of years, we started, I don't know, raise your hand if you've heard that we have a food pantry on campus. Fantastic, I love that. Because this is something new, we were only the second in the state to offer a food pantry within our campus. And it has come in very handy as far as faculty, staff, and students, that sometimes we wouldn't really think, but especially during the holidays, we had a shortage and we had usage of that pantry. And I appreciate the input from everyone, because this is a campus effort. You can only be successful if you have your basic needs. You think about Maslow's hierarchy of needs and those basic needs. You can only be successful if you have those basic needs. And so that's what we're trying to do as a campus, is to provide those basic needs and give them the things that they need to be successful.
Yes.
I have a request, perhaps. I'm still new to the university, so there are a lot of things that I don't know, and I was wondering if there is a possibility that all these initiatives and partnerships could be put together in some sort of repository, just a place where they are all listed and the information is standardized, so that we can actually increase and promote and improve the conversation about what is going on at the community level.
We are in the process of building a repository, a directory of spaces in which faculty from different colleges work together, and that could be community space, so that would be a part of it as a part of our interprofessional education and research efforts. We're developing that directory. And so I think a spin-off of that could be just that. The greatest part is there are graduate assistants assigned.
Can I also put to your request, I'm on the Community Engagement and Service Learning Standing Committee, and this is something that we've seen as a great need across, Joy's on there as well, as across the campuses. There are a lot of wonderful partnerships, outreach, service learning opportunities, and we have not had a central place to keep all of those. And so we're hearing that cry over and over again. We need some resource to have that happen. And, I'm going to take this information also to that committee and continue the call for that.
If you sit in any one of the Women's Fund meeting where they're trying to allocate funding sources, to these initiatives, it's amazing, because you think how many really need that funding, and there's only so much to go around. But it doesn't always have to be, like you said, in terms of funding. It can be in terms of time and effort and volunteering to increase, the assistance within the community.
One of the things that's always challenging too is, the need for additional dollars and volunteer time and stuff. But the idea would be that these needs wouldn't exist, right? So, from a political standpoint, what's the connection to our health professions and maybe the political realm and advocacy, and how we encourage students to obviously provide the support and services, but ultimately, are there systems or structures, political structures, that keep women and these issues sort of challenged?
If you attend our local government meetings, you will see a distinct lack of women at the table. And it is my opinion, and only my opinion, that until we have an equal number of women at the table, that women will not be taken into account when making decisions. On a larger scale, I think there's a lack of understanding of the public health connectedness of issues when making policy decisions. Oftentimes we're not creating a policy that is health promoting. We may be even creating policy that is detrimental to health, not because our policymakers are bad people, but because they are not trained in public health or not aware of some of those systems. So my first cry, I wasn't joking when I said I'd love to see your names on the ballot. I continue to be amazed at the lack of representation of women in local government. But when you look to the audience, when you look at who's sitting in the audience at local government meetings, it's majority female. So I do believe that women are heavily involved and care very much about local governance and local issues, but they need to come to the other side of the aisle, or of the table, I guess I should say.
Education, it's setting an example for women being in these positions, I think. But it's also, you kind of have to have that innate desire to want to help and have that drive to make a difference.
And even Phyllis and I and Brandy had the good fortune to attend the Women's Economic Council Summit. I never say that title right. Back in October, and you get to interact with your female legislators at that conference, and there were 6 women there, and they were all introducing fascinating pieces of legislation. Addressing perpetrators of domestic violence and sexual abuse, addressing untested rape kits, addressing issues for women's health, and none of those bills passed. None of those bills passed. Every time they introduced another piece of legislation, they explained that it didn't pass. So it was incredibly disheartening, even at the state level, to hear that. But also, there were some motivational sessions where it said, if you are up for running, run. If you don't want to run, encourage someone to run. And if you don't want to have anything to do with it, then at least go to your meetings, at least read the paper, at least stay on top of current events so you know what issues are coming down the pike that would affect you. But a lot of people aren't comfortable running. It is an excruciating process. But if you don't want to run, encourage someone to and support their campaign. So.
And we also do ETSU Day on the Hill, where our students are set up in the lobby. They can go over research. They can discuss topics that their college is either currently researching or areas of concern for them. And that's made a big difference. I think that's really impacted as well to bring to light some situations. I mean, you've been there.
Oh, so. Yeah, but unfortunately, we're not going to be able to do that this year. But that really has helped tremendously. The key word, I think, is education. And I think Katie should be commended for going to the other side of the table, because it's hard with all those males. And I know.
It's hard anyway. I mean, it's hard.
It is. But I commend you for that.
Well, thanks.
And congratulations.
I just wanted to add something. I have heard that worked in the field of environmental health, and there was this situation in the state of Washington where there was some environmental pollution having an impact on human health, and a lot of scientists were brought to the elected representative to try to bring some changes on board, and the changes did not happen. So, the people in the area took a different approach, so they decided, let's just bring these people who have been impacted by this pollution to our elected representatives so they can tell their stories. And I've been told that the stories of the people were much more powerful in getting the elected representative to see, think, and change their point of view and change the policies with regard to what was going on. So I heard that, and I became more and more interested in trying to understand how can I tell the elected representative the real stories. And I think that public health actually provides a really good base for that to happen. And I think that beyond gender, the issue really is how are we actually preparing our messages. And I'm not an expert in communication at all, but that's something that I would like to learn more, and I think that it'll be interesting to have more conversations about.
I'd like to hear you say that. I've just spent the 2.5 hours before I came here in a health communications class, training our master's students in just that and how to tell their stories. Oh, Olivia told her story last year. Graduate of the Toledo program. So we're trying to work on those skills too. How to tell your personal story of self, how to identify with the common values of the people you're talking to. I think that's important too.
I want to thank you all for coming and watching our time, and I want to thank